so much. Good evening, everyone. Myself, Kiran Kumar Chamudugunta, with 16 plus years of experience into healthcare IT careers and software jobs, whatever you call it as. But I would like to thank participants especially because we understand how busy are you. One side World Cup is going on, and the other side Kalki movie is being released, and a lot of movie lovers and movie buffs are running towards theaters. I can understand how busy are we. Okay. And at the same time, why I would like to appreciate is, in spite of this busy schedule also, you are making out of some time for your career as well. Okay. This was the thought which I got when I joined my job, and everyone started asking me in 2008 itself, Kiran, why did you started joining these kind of jobs? Okay. Before that, I'll like to share and introduce my profile through my LinkedIn, and I'll share my LinkedIn ID also as well here. When I joined my first job in 2008, okay, there was a bit curious. A lot of them were asking that, Kiran, you are from pharmacy background. What are you doing in an IT company? Okay. That asked even my mind to rethink about my career. Okay. Normally, what happens if we do B.Pharm, we should be doing some medical representative job or some other jobs, right? Pharmacist jobs or whatever you call it as. But luckily, by God's grace or by my general knowledge or awareness, whatever you call, what I can do is I'll share my LinkedIn ID here. You can send me connection invite there. Okay. Directly do that. Okay. If you click on my this above link, I'll be able to connect with you because I have already 30K followers. It's not to increase followers, students. It's just to we stay connected on a professional platform. Okay. Nothing more than that. Okay. So that we are staying connected very professionally. Yes or no? I'll send you my LinkedIn ID here so that you can send me an invite. Okay. Please do that during the session or after the session so that I can be your career guide or career coach for your career, because we have mastered it. We have done a good job, and nearly 250 plus students have got jobs. And we are happy to say that we have completed 6 years at RISE training successfully. And Reshma Shaikh and our trainers team are part of this grand journey. Okay. Please send me LinkedIn invite also. Click on connect. Never ever say that try to send follow button, because I have enough followers. Always click on connect button. I'm not able to send invites because this is already, my limit is done. Per week, I guess LinkedIn gives us 50 plus connections here. Having said that, I would like to start my session with my basic introduction. Myself, Kiran Kumar Chamudugunta, with 16 plus years of experience here. And I started my career with pharmacovigilance in 2008 in Tech Mahindra. Then I started my career with Bioclinica. Again, I started my career with Cognizant Bangalore. Not Cognizant Bangalore, it's in Mumbai. Then I started in Icon Clinical Research. Then I resigned my last job in Icon Clinical Research. Having said that, I would like to show my career chronicle so that you might be impressed or you might be interested to know more about me and our institute. This is my career chronicle. Rather than I show my introduction there, I would like to show it professionally here. See this? This is my whole set of experience, guys. I worked for Pfizer in October 2008 itself. Then it was now Tech Mahindra. Earlier it was Synology Pharmacovigilance Services. Again, it was Bioclinica and Quenesca, and companies' names keep on changing, right? Then I was there a team lead for a very shorter period of time in Mumbai Cognizant. Then I worked as drug safety coordinator in Icon Chennai. Okay. Here, my thought process has been changed actually. Okay. It's not just about pharmacovigilance. And I thought that we can do beyond that. Then I thought that, okay, why don't we learn new skill sets and why don't we move our career ahead? Okay. That was a path-breaking moment for me. Not just learning regular pharmacovigilance or doing other things here. I felt that yes, we can upskill and we can climb the ladder from here. Yeah, see, the connection started coming up. Okay. This is how a good connections, a good professional network grows, right? You can come here and you can say that, sir, I have attended your webinar and I have attended your seminar so that what best we can do here. Okay. This is how it processes and progresses. Okay. Very good. Let me move on to the session now. Yeah. Just to have a glance here. Why did I combine these both 2 points? Okay. When we enter into a campus, we see both of them. One is BTech college, one is pharmacy college. But I was always feeling painful for our pharmacy students and profession. Even I am from pharmacy background. Why don't we see placements data? Why don't we see placements data for BPharm students, even be it NIPER, be it universities, be it bigger campuses, whatever they're calling. I don't see bigger posters saying that a campus selection happened and bigger campuses say that my PharmD student got 10 lakhs packages. We never see those kind of things. Okay. Initially, we were calling this as pharma IT careers, but we have modified this into healthcare IT careers, where we can club pharmacy professionals, physiotherapy professionals, and dental and Ayurvedic and homeo people as well. Let us see what's there in our store for us. Let us see. Yeah. Traditional careers. Today we will discuss all these things. Whatever software careers, whatever thinking, what's there in your knocking in your mind. I would like to differentiate them with the 2 topics. One is traditional careers, another one is trending careers. And what are all the benefits out of these careers? Okay, unless until I don't say we have a good benefits here, I don't think you'll be engaging still last moment. Obviously, benefits are there because being a veteran in this industry, I've been into this industry from past 16 years. Still, I could see students are going and joining as a medical representative jobs. Still, they are doing QA QC jobs. Still, they are stuck with the production jobs. Even girls and women, they are approaching us with a lot of pain and grief, saying that, sir, we don't know these kind of jobs are there. We don't know these kind of courses are there. That was a very painful point for me. And that's where I thought that these kind of sessions and webinars should be conducted, irrespective of you join our course or not. We regularly conduct. Me and Reshma have conducted nearly 200 plus webinars from past 4.5 and 5 years, 200 plus webinars, trust me. Webinars continuously we conduct, and I give a lot of seminars in college, nearly 50 plus pharmacy colleges and 3 to 4 nursing colleges also we have covered. Having said that, after graduation, everyone's mind is like this. When I ask 2023 passing out means they don't take course. They come to me after a year of time. Today it happened. One of the person which I approached him in the last June, July, he was not able to make a decision, and he attended a pharmacy college and he attended a core pharma company job for 1 year. Then he realized that this is not working for me. Okay, but I knew that before 1 year this is not going to work for him. I knew this already. Okay, that's where a good mentor comes in place. We already knew this. This is the path which we traveled 20 years, 15, 16 years ago. You have a lot of options now. Earlier, you had only few options like production, QA, QC, teaching, R&D. That's it. Only 4 options you have. Now, life is full of buffet and life is full of options, but still you are struggling to make out a decision. That's where a good mentor and coach like me comes in the place. Let us demarcate the differences between traditional careers and trending careers. Traditional means these careers were there in this in this place long back. When they were there? They were there in long back. That means say that 30, 40 years ago. Yes, teaching was there, marketing domain was there. Pharmacist jobs exist because we have a lot of MedPlus and NetMeds are there, Apollo pharmacies are there, retail pharmacies are there, especially during Corona, after Corona. Even each and every pharmacy is equal to a Kirana store now. How many of you agree with this point? Could you please raise your hands or do some chatting on chat box? Could you please say hi or yes or no? Can you say, sir, we agree with you? How many of you agree? Can you say yes or no to me? Hello? More of the pharmacies have grown up now. Lot of pharmacists, lot of students come to me and say that, sir, I will start a pharmacy. Now, what will you do after starting a pharmacy now? Because already there are existing stores here. Already lot of thousands of stores has gone up. How many? Lot of people, they said that we want to start it. We have started it. Lot of issues are there. Okay. This is a very problematic thing, right? Knowingly, unknowingly, without knowing the market, what they're going to do? They're joining a pharmacy or starting a pharmacy. Production, QA, QC jobs. Even that can be done by a BCom candidate, BSc candidate. There are some companies who are running this production QA, QC department with the BTech professionals also. Quality control, hospital pharmacist. I'm not criticizing someone here, but these departments are being run by them. That means any degree candidate is doing it, right? And hospital pharmacist and researchers. These were a tradition from past 30 to 40 years. Okay. At least these are trending careers. Even for me, medical coding is not a trending career. I'm seeing it from past 20 years. I should move it to medical coding also here. Here I should write HEOR. What is it? HEOR, Health Economics Outcome Research. Pharmacovigilance, medical coding, medical writing, CDM, business analyst, computerized system validation, clinical SaaS, Argus administration, and regulatory affairs. These are all the trending careers. To be honest, I'm a 1990s, 1980s kid. I feel that I have grown that, not feel, that's true. I have grown by seeing Doordarshan TV channels. I am the kid of Sachin Tendulkar era. Now you are kids of Virat Kohli era. Yes or no? There is a huge generation gap with the thoughts, with the job search approach, with the mindset also. But the sad part is you've been stuck here. I am here. Okay. There is a reversal of trend and thought process. I expect you to do this, but knowingly, unknowingly, what is happening here? My brothers and sisters are going and choosing same old careers because we are from traditional families. Yes or no? Avana kada? Avana? Dinesh, Chaitanya, Naresh, Shankar, Chandini, is it true? Sri Sivasakti, Somya. Because we are from South Indian traditional families, does that indicate that we should choose only production? We should not take a trending career, HEOR or CDM or CR. We should not do computerized system validation job. Be a trend setter. Be a torch bearer. Be a path breaker. Whom you should be? You should be a leader or follower. Just tell me. Should you be a trend follower or trend creator? Trend setter. What you should be? Let's suppose if you are taking a pharmacovigilance course or computerized system validation course or CDM, everyone will follow Naresh or Anil or Sri Sivasakti. They'll say that, yeah, say being a pharmacy professional, she's into clinical SaaS now, she's getting 6 lakhs package, 7 lakhs package. Everyone will be talking about you, right? Or else if you go and join in a pharma company or a pharma marketing, what will they feel? Everyone is doing that. You haven't done nothing new. You haven't breaked that path, right? You've been the same old follower. You're a follower of your mother, you're a follower of your father, and you're a follower of your leader at your class, and you're a follower of your senior at your college. Because your senior have done medical coding, I'll also do medical coding. Very sincere you are, right? Is it true, Naresh? Is it true, Saurabh? Chaitanya? Yes or no? Shankar? Anagala? Are we followers or are we leaders? What you want to become actually? Having said that, what are all the benefits of these software jobs or healthcare IT careers? Okay. We can work 5 days a week. You'll get work from home jobs. I always say these careers are progressive and you can have a lot of abroad opportunities. How many of you agree with this point? If you do production, you'll get abroad opportunity. If you do pharmacist job, will you get work from home? Please tell me, don't you think these are productive careers or not? How many of you agree with these 5 points? If you work as a medical representative for 10 long years in India, will it be progressive career? Or it is going to be stagnant career? Chaitanya, Chapandi. Yes, Naresh, we will answer you that also. Keep your questions locked. Chat your doubts here. For each and every question, we have already a video. We have done 15 reels series here. Direct job, no. For sure, no. Either you have to go for MS, either you have to gain experience, or your father have to send you, or someone have to sponsor from the other country. Definitely direct jobs, no. No daydreams accepted at RISE trainings. Which kind of careers are there? Progressive careers. Production, no. Teaching, no. Then abroad opportunities, you'll have work-life balance. Why am I telling that is, I have seen very good life of work from home. I have enjoyed this. Then I thought that why don't I gift this my to juniors and my brothers and sisters? Yes or no? I have made my commitment, which have led to nearly 250 students getting work from home jobs at RISE trainings. Whoever have joined RISE trainings 5 years ago, 4 years ago, now they are getting 10 lakhs, 12 lakhs packages and they're happily working from hometown. They are spending time with their families and they're happily enjoying the work from home. How many of you agree with these 5 benefits? Is this 5 reasons good enough to carry the session for the next 20 minutes, guys? ఈ 5 reasons చాలా ఇంకేమన్నా కావాలా మీకు? Is it good? Who don't want to enjoy software careers? Who don't want to enjoy weekend life? Okay. We see students or professionals who are joined jobs in teaching and pharma company. Saturday, they have to go to job. No work from home, especially people who are working in core pharma companies. They are supposed to go to pharma companies. Don't you think that they should travel at least 1.5 to 2 hours, 3 hours per day? Yes or no? Because these pharma companies are present within the cities or outskirts of the cities. Where are they? Hello? Can you please tell me? They are supposed to travel. That means half of our life is going in travel. How many of you agree with this point? Before I proceed to next slide. Don't you think we should travel or not? Minimum 1.5 to 3 to 4 hours of travel goes in this careers. Yes or no? We are supposed to travel. There is no option. Having said that, I am introducing you each topic here. After that, I'll take your questions. The first thing is at pharmacovigilance for rice trainings, it is a bread and butter from day one. And then we have seen a lot of jobs and a lot of placements for pharmacovigilance. As you know, it's the science and activities related to detection, assessment, and understanding and prevention of adverse effects. And it's a good career option. And I would like to clarify some of your doubts here. Most of think that pharmacovigilance is stagnant and it's not a stable career. There is a lot of layoffs here. Like that, people are telling, but I'm not sure. Some masala is being added in between. Lot of employment is there, guys. In 2011, I have written a list of pharmacovigilance companies. It was just 60 and 70. The same list is still circulating in the market. Okay. Having said that, now I have written the same list in 2021. Trust me, it is 210 companies. Within 11 years, number of companies have grown here. How many of you agree pharmacovigilance is a viable career? Yes or no? Pharmacovigilance career dull అయిపోతుందా? Companies grow అవుతున్నాయా? Pharmacovigilance growth ఉందా లేదా? But for time being, openings might be little less. Openings might be little less. It doesn't mean that doors are completely closed. Never ever think like that. Don't go with half-cooked news. Don't go with half masala news. Don't get misguided. That is my request here. Okay? Don't get misguided by your seniors or peers or sometimes by faculties also. I agree, openings are less. It doesn't mean the doors are completely closed. Having said that, let us see this. What is the career growth and how it is? Artificial intelligence comes and automation comes. It doesn't mean that it is going to completely replace drug safety associates. It is completely going to eat away pharmacovigilance careers. If that is the case, I'll tell you one small example here. We know what happened in the banking sector. In olden days, golden days, how many employees were there in banking? Bank ma, nearly 20 people were there, 10 to 15 were there. Now, if you go to bank, hardly 5-6 people are there. We see a lot of banks also being merged nowadays. And in place of these banks, we see a lot of payment gateways. Suppose if you are joining in our institute also in near future, how you will be paying us? GPay, PhonePe, Paytm, and WhatsApp payments. Then my question comes is, if GPay have come up, what is the purpose of HDFC Bank here? If Paytm comes up, what is the purpose of other bank here? Trust me, artificial intelligence comes and automation comes. It makes a better software. So it makes our job easier. And it's not going to kill your jobs. Any profession, if you take even robotic surgeries or robotic things happening in hospitals also, robots will do surgeries, agreed. But those are done under supervision of experts, doctors. Okay. I hope this is giving you some confidence here. And what is the salaries here? For freshers, it's 2.5 to 4.5 lakhs based upon the company. Your job title here is drug safety associate, trainee junior data analyst, then medical safety analyst. Like that, it's going to be, title will be changing, but basically what happens here is title might change, your role might not change. It depends on company to company. Title of those will change, but we are supposed to see how it happens, in which company you are going up. And starting salary, 20, 22,000 and 18,000, 15,000, and some startups pays 10 to 12,000 also. It depends upon how you are looking at these things. Then, what about a senior drug safety associate, team lead PV scientist, manager, and service delivery manager? And packages are decent enough. Few of my friends are also getting 40 lakhs per annum now. And it all depends. It's just like in a class, each and every student doesn't shine, right? Only few of them shine, and they go up in the classes, and they show very good growth in the market. And they shine. Okay. Exactly. Quantities of work will be reduced and work burden load will be reduced. And actually, we are planning to do some presentation on AI impact and automation impact also, which we have done with our trainers and guest faculties earlier. But this is a good career to choose. Don't lose hope. But we could see a lot of students are running behind medical coding because only answer is you'll be hired fast. And second option is number of openings are good enough, but only the negative side of medical coding is, as per my 16 years of perspective, it's only challenges you are supposed to clear CPC exam there. Here comes medical writing. What you do is you do a lot of writing because we see it is given, this is a career for highly qualified, not highly qualified, for a good qualification like MPharm, PharmD, MSc, PhD, and MPharm, PhD are people who can choose this career as a medical writing as a updated career. Okay. And at RISE trainings also, we have seen a lot of career transformations who came to us with the MPharm, PhD, or BDS or MDS also during Corona. They were struggling with their salaries at institutes and clinics. We helped them with our career training, and they are able to got into these careers. And it's a good career to choose also. Medical writing also is there, and different backgrounds are there, and lot of work from home options are there. But for BPharm, we are not encouraging. For at least PharmD, BPharm, we are encouraging to choose medical writing as a career. And CDM we know. And for pharmacovigilance also, I would like to list out some softwares here: Argus, ArisG, and VigiFlow, VigiBase, Empirica, Trace, and we have 25 plus softwares are there. And recently we have listed out nearly, I think, I guess we have listed around 25 plus softwares. Having said that, what is clinical data management? A lot of students ask me, sir, I would like to do clinical SaaS, I would like to do RA, I would like to say CDM also as one of the career. CDM also is one of the career. It's not, we are not against clinical SaaS or CDM, or we are not against to RA. Only challenge at RISE trainings is we are very ethical and very honest here, and we don't encourage students to take overrated profiles and less success rate profiles. Same with clinical SaaS, number of jobs are less. If you do clinical SaaS, you're supposed to wait for 1 or 2 years, and you need to arrange some fake document or a fake experience here. That's the challenge. And that's the reason we don't promote it so well. Okay. This is the course here. CDM also, we have softwares like Rave, Medidata, and Oracle CDM softwares are there. And it's a good career to choose. When compared to pharmacovigilance, medical writing, and CDM are good. Pressure also is little less in these two departments, in medical writing and CDM. As you know, pharmacovigilance is a regulatory environment. Even these are, but there you are supposed to send cases on regular basis. You are supposed to send them fast. And that's where people say that it's a pressurized environment. But tell me a job where it is not pressurized, unless until it's a government job. Even government jobs have their own timelines and strict things to deliver things in timeline, right? But people say that pharmacovigilance is very stressful. Yeah, pharmacovigilance is very much troublesome job. Yeah, I cannot do here. I can't take pressure here. What can you take? You can take 24 hours of reels and shots on mobile. You can always chat with your friends. You can do gaming. You can do betting. You can play rummy. You can do everything except taking a good career. You have to forgive me if I'm telling something very straight away here, but you are supposed to take little pressure when you are young. Okay. When I was working in Satyam, I used to work for 12 to 16 hours in office. I used to go to office by 7 o'clock, 7 a.m. and I used to leave office by 9:30 and 10. 12 hours is very common thing at our initial days. Only thing is you're supposed to understand why it is important to work very hard when you are young. What happens in CDM? Clinical trials come, safety and efficacy analysis happens, which helps with product development. And it's not just CROs. CROs means clinical research organizations or contract research organizations like Equia, Paraxel, Thermo Fisher, PPD, and Icon Clinical Research. These are all clinical research organizations. But if you take IT companies like TCS, Cognizant, and Accenture, and HCL Technologies, they're also doing the outsourcing of these projects, and they're also doing a great job here in terms of outsourcing and these things. And trust me, this is the career which is always evergreen. As I told you, I had a habit of reading newspapers and having some general knowledge by reading these newspapers. As you know, these newspapers, they overboast and write, say that pharmacy profession is really good. Pharmacy chadivite bangaru bhavishyattu. Pharmacy chadivite అవకాశాలు మెండు లేదంటే అపారమైన అవకాశాలు ఉన్నాయి ఫార్మసీలో. Because we see a lot of writings there where parents are being impressed and even we impressed. Having said that, clinical research is the best career to choose, but only challenge here is sometimes we are supposed to travel. Okay, we are supposed to travel, and that's where we are supposed to think of this kind of career. And these kind of jobs are there as in work from home based also, where you can think of doing work from home options choices also. Then let us see. We have both the studies here. We can do observational studies and clinical trials also. Then observational studies and what is another one? Clinical trials. Clinical SAS, as I told, it's highly overrated. And what is another one? It is openings are less, but package wise it is good. The problem with them is you have these kind of roles here: data analyst, clinical SAS programmer. Those kind of good job roles are there. It's not about job roles here. The problem here is openings are less and success rate is less. And today also one of student called me who had taken course 1 year back. Still she is struggling to keep her momentum high. And she told that I'm about to leave SAS career. I have invested nearly around 60K, sir, and I'm not able to get some hope on this career. Sorry, sir, I can't choose this as career, is her word with me. Because institutes don't guide you properly. I'm not blaming any institute here. They don't tell you on upfront, saying that you are not going to get this job faster, and they are not going to tell you immediately upfront. They are not telling you. Okay, that is a huge challenge here. Always go with your trusted mentors and go with people who guides you really. Business analyst course also is good, Naresh. It's a good course. You can choose it. And it's all about our perception, what to do and what not to do. And I told you medical coding is the best career at this point of time. You can choose it, but only problem here is you are supposed to clear CPC certification, and then only you'll be able to survive here. And in Chennai, Chennai is hub for medical coding. There are a number of jobs there, and there is always this thing going there. Walk-in interviews are going on there, and a lot of regular hiring is going on. To start a career with, yes, you can join medical coding. But I've seen few of my friends, they have come from medical coding to pharmacovigilance, from pharmacovigilance to, they have come to clinical SAS also. But it's all about our understanding what to do, how to start career, rather than sitting idle at home and 1 year, 2 years. If you're wasting your time, definitely there is wrong with your mindset. You can start your career with coding. That's not a problem. A lot of people don't like coding. They say that I don't like it here. But I don't know, some of the students joined those careers and they came back to home because they did not like it. It's a very good dynamic profile, and any lot of certifications also happen. And medical communications also is one good career which you can think of. Just like one communicates with doctors and patients. Whenever they come up with the medical representatives, they come with a lot of brochures, right? They also communicate with doctors with a lot of these updates. Journals, articles, educational materials, regulatory documents, patient education brochure, sales training. These all materials are written by MPharm, PhD, and PharmD doctors also. And these kind of projects, you can see companies like, we could see companies like, what is that? What is those companies? In Apollo, we see in Apollo 24/7, we have these kind of projects. Crexus Health also does this medical communication projects. And two of our students got jobs there. They're still working, PharmD students, and two of them are have done their internships there. And it's a good career to choose because you're getting work from home and you're learning and you're working for your same profile. What exactly materiovigilance is? Can you tell me? After pharmacovigilance, we are seeing a lot of growth in this profile, and it is having very good options like materiovigilance, where we are supposed to see the updates of devices and regulations and what is present here. Especially for devices, it have come up in India in 2015 as a MVPI program. Pharmacovigilance came in 2011. In private sector, it came in 2006 and 7. I'm the second batch of this pharmacovigilance part. Here we have all those things. And computerized system validation, even I worked there for 5 long years, 4.5 years, I guess, in HCL Technologies. And I inspired nearly 3 to 4 of my students to go choose this profile. These wordings and these titles might be a bit new for you guys, but trust me, these are all the new age careers. What are they? New age careers. Don't go with production. Don't go with medical representative job. Don't go with the pharmacist job. You might have some family compulsions. You might be having some financial issues, or you might be having something pushing you to do some job here. Those are all not good jobs in as per my learnings and as per my experience. For that sake, even anything is a job. If you go and join a nearby pharmacy at your home, that is also a job. But for me, it's not a good job. You're agreeing and you're settling down for low, saying that అది చెప్పాలంటే KGF 1లో డైలాగ్ ఉంటుంది. వాళ్ళు రాఖీ బాయ్ కోసం బాంబేకి వస్తారు, బెంగళూరు టీం వాళ్ళు. చూసి ఏమంటారు వాళ్ళు? బంగారపు హుండీని చిల్లరేయడానికి పెట్టారు కదరా అంటారు. అవునా కదా? అట్లా చిల్లరకు పని చేయొద్దు. If you are doing it, do it for good. Get good packages. At least aim high. Okay. Don't work for 10,000, 12,000 for lesser packages. At least try for 20K, try for 22K, try for 18, 15K. Only sad thing in pharma is, in pharma companies and pharma projects is, you will not see packages immediately. You will see we are supposed to wait for, we have been blessed to wait for 1.5 years and 2 years. Then only our packages grows here. You don't have a luxury of a regular IT personals. Okay. They get 6 lakhs package, 10 lakhs, even 12 lakhs package also as freshers. But we don't have such a luxury here. Okay. Let us see. CSV is there. It's a good profile. And regulatory affairs. It's present in CRO. It's present in core pharma company. It is present in IT companies also. It is present everywhere, and it will help you to get right jobs in the right moment. Who are all eligible to do these jobs? The persons who have attended this session. We know that most of them are B.Pharm and M.Pharm, and most of them are qualified persons here. We agree. Having said that, with their qualifications, along with qualifications, what do you think they need here? Can you tell me? Emma? They need right skills. I have born in a generation of qualifications and certifications. Now you are born in a generation of skills generation. Everything is skill. If you know to cook a biryani, you are a skilled biryani chef. If you know to do a good haircut, you are a good barber. In the same way, here are the salary expectations, because we are living in a generation of salaries and expectations and more adamant lifestyle and adamant aggressive growth generation. If you see this, we see these are all the packages. These are rough packages which we collected based on our experience and based on the information available in the internet. Okay. Thank you so much for joining the session. And it's time for QA. I'll stay here for 12 more minutes and I'll take your questions also, guys. And what I can do here is I can share a link here, okay, an ebook link here, which will give you, I'll share it in our group, okay, the group which you have joined us. It's an ebook, okay. I have a plans of writing a book on careers and jobs, how to get jobs in next 100 days. Out of that 100 pages or 150 pages book, I'm going to gift you 10 pages of ebook for you. Okay, 10 pages of ebook, where you're supposed to click on the link and give your phone number. And data analysis is good actually. You can give your phone number and you can give your mail ID there, and I'll give you permissions to take the ebook from there. Okay. Please fill the form also, whoever have joined. And we are gifting you ebook also. Ma data analysis good do, business analysis good do. Any job is good for this case. Only thing is you need to sit 8 hours in front of system and work. The problem with current generation is they are not able to sit in front of system for 8 to 10 hours. But they can scroll their phone for 24 hours. Even if we go to Instagram Reels, we will scroll it for 4 hours. If you go to YouTube Shorts, we will scroll it for 4 hours. But if I ask you to sit and work for 8 hours in front of system for medical coding jobs, are you ready to do that? If you are ready to do that, jobs are waiting for you. Not single job. Multiple jobs are waiting for you. Okay. I'll show you the sample of ebook also, which I have written for you. But only thing is I have given you the links, guys. You can take it from there, that ebook. Consider that ebook is a gift from my side. I think downloading started. I think it's me, Gautam. I'm going to give access to Gautam and other people also. Super. Rajulapati Anil, Sujimani, super. This shows how serious are you, yeah? You are serious. You are serious. Very good. Notifications are pouring up. Very good. Share your questions here. Thank you, Reshma, for sharing it. And ask your questions, because you'll not get a mentor who is having 16 years of experience and ready to invest time. Okay, what are we doing here? It's not about admissions or business or classes here. It's about guidance. You're joining course, that is fine. If you're not joining also, that is fine. But who is going to really help you with real guidance? That's what a girl who have taken a training in clinical SAS 1.5 years ago, she did not get job in SAS. Still, she is struggling to enter into SAS career. We'll make sure that you are not falling into such misguidances. We'll make sure that you are not falling into such traps. Why are we calling those are traps? Ona kada. Ma doubt le annunte Telugulo adagandi. Mohmatam em ledu. I'm happy to answer. Definitely, Gautam. We are sharing our number here. It's all about your interest to gain skills and knowledge. Without gaining skills, companies list iste em cheskuntaramma. List kavalante mem ichestam, Soumya. We can share you the list. Right away, I can send you the list. Pharmacovigilance companies list anta istanu. What will you do with that list? You are supposed to take right coaching, right certification. Then this list of companies will help you. If you Google, you'll get it. I can send you list of pharmacovigilance right away. I can send you that list of companies, Soumya. But what will you do with that? Then comes questions of certifications. Then question comes about what you are going to do with that list. I can send you. That's not a problem. List of pharmacovigilance companies and how much time I can send you in our group. But what are you going to do with that list is my question. They are
Sir,
certified.
can I speak now, sir?
Yeah, please, ma. Your good name?
My name is Soumya ji, sir.
Yeah.
Sir,
Tell me, from which place are you from?
I'm from Chennai, sir.
Go ahead, ma. Okay,
Sir, why I'm asking the list is basically there are, according to me, I segregate the companies into three types: first grade, second grade, and third grade.
Great. Okay, fine. Okay. Go ahead.
Most of the companies I know is it in first grade, sir, like Accenture, Icon, and HCL. Like, so if I am trying in that companies, and my resume is
Your
getting
qualification is B Pharm, M Pharm, or Pharm D?
B Pharm, sir.
Okay. Which year passing out, ma? Which college, ma?
This year passing out, sir. Bharat University, sir.
Okay. Fine. Okay. This year you are getting passed out. Okay. Nice.
Yes, sir. So
You know Shahul, Sara?
sorry, sir. I don't know, sir.
Your voice is breaking a lot.
Sir,
Your
now
voice
can
is
you hear?
breaking.
Now
Yeah.
can you hear me?
No issues. Go ahead.
Yes, sir.
Yeah, please. Go ahead.
The thing I heard is if we are trying as a fresher, if we are trying in a first grade company, there is less number of chance to get the job. So if we search in a third grade companies like Omega Healthcare, likewise I don't know much company names here. So we can gain
First thing
experience
is,
and we can try in the first grade company, they said, sir. So I need as you said, you have list of company like 210 companies name you have, you said, sir. So if I have that list,
have given
it
you
will
those 210 companies, ma. It's not about list of companies, Soumya.
okay,
There
sir.
are for getting jobs you need 4 things. Okay. First thing is qualification, which you already have. Okay.
Okay,
B
sir.
Pharm, you have already one thing. Second thing is you need to be certified on some domain knowledge. Suppose if you are looking for pharmacovigilance, if you have a certification, that will help you to get jobs faster. Will you agree with this point?
Sir, my question here is compulsory that certification is needed because that pharmacovigilance topic already we cover in B Pharmacy 6 months we are studying, sir. Whether that is not enough.
That is the problem. Not 6 months they are giving you. I know. Yes, I got it. They have given you as a subject, but not in depth. And a small certification will make huge difference here. If suppose you and your friend are attending an interview in Accenture, okay, sir. There are few companies who consider freshers who already have a certification, that is the difference between a trained fresher and a regular fresher. Yes or no?
Yes, sir.
I'm telling you, it's not mandatory. It's not mandatory. But if you have certification, that will make difference. Second point.
Okay, sir.
Third point, you should have right reference to get these jobs. What you should have?
Sir. Right
references.
During my interview.
Hello. Tell me.
Exactly, I faced this situation where in my first interview, my first question, that is, did any certification courses? I said no.
Exactly.
Immediately after 2-3 more questions, they got rejected.
Anil, these people are selling unnecessarily courses. These are taking money and they are not showing jobs for you. I'll ask you one simple question, Soumya and Anil. In India, 1750 pharmacy colleges are there. As per IPC website, PCI website, how many colleges are there, ma?
75.
1750.
1750.
Sorry, sir. 1750.
Even in Tamil Nadu itself, we have 120 colleges, sir. How many colleges are there, Anil? Even Andhra, Telangana, 200 colleges.
Yes, sir.
Okay. Yearly passing out strength is more than 6 lakhs. How many?
6 lakhs.
More than 6 lakhs. Maybe that number might be more or less. I'm telling you the rough stats. Tell me how many jobs are provided by government? First question. we see very less number of jobs, right, Soumya? For the 6 lakh
Yes, sir.
students, do you think government provide every year 6,000 government jobs? No, right?
No, sir. No, sir.
At least 600 jobs across India, government jobs, I'm telling you. Very
Not at all
less
possible.
number or zero number of opportunities are provided by government sector. Leave about government sector. Coming to private sector, show me a pharmacy college where every year campus placements happen and they've been hired to very good companies like IQVIA or Accenture or HCL Technologies. It doesn't happen, right, in a pharmacy college. That's
Yes, sir.
where these kind of institutes make differences in your lives. Trust me, hardly 130 institutes are there in India, like rice trainings. How many are there, Amma?
130.
130. 130 is to 175, 1750. That means 7 to 8% are there. That means for 10 institutes, this institute is less than one college. Yes or no?
Yes, sir.
Please download this ebook, ma. Ebook download cheyandi. I'll give you the permissions now. What I'm trying to say here is, Soumya, to get jobs, 4 points are needed. One is your qualification. Second one is certification. Third one is the reference. Fourth one is at least job search information. As I told you, I can give you the 210 companies list. Shall I
Yes,
tell
sir.
you how should you use that? You should use that list. Can I show you, Anil?
Yes, sir.
Can I show you? నేను చూపెట్టిన మీకు లిస్ట్ ఎలా వాడుకోవాలో మీరు. For me, that list is more important. But for the first time, I've seen that Soumya have listed them differently and she have given her grading. I'm not mistaking her, but someone is, we can refer if you take coaching from us. We can refer. I'll tell you, if suppose Soumya is looking for jobs in IQVIA, how should she do? First, she should type a company name here. ఏం చేయాలి? Company name type చేయాలి. Then what should she do, Anil? Company page follow అవ్వాలా లేదా?
Yes, sir.
Sir. Follow.
You can follow the company. If you follow the company list, what will happen? You will see the list of openings here. Yes or no?
Yes, sir.
After that, you can connect with people. That's what I say in my LinkedIn masterclass. We can refer you. If you are our student, we try to refer. Okay. It's not that we are giving you 100% promise. We try at least. Follow the company. 1221 connections are there. My friends are working there. My ex-colleagues are working there. I can message them. And if I don't know them, what I can do? I can newly connect with those people. You click on them and you ask them job. The problem here is, Soumya and Anil, if you apply jobs, what will they say? Do you have that knowledge? Do you have that certification? Then Soumya will go and ask him, sir, can you provide me some interview questions? Do you think that they really will help you, Soumya?
Sorry,
They'll
sir.
say
I
that
couldn't get it properly.
if people, do you think people are such kind enough? Do you think they have such time to spend time with you and help you for jobs?
Sir, actually, the HR or company people, they don't have much time to help us, sir. But you can help us, no, right, sir?
Free help not
So
possible.
that's why we are asking you, sir.
That's what, Soumya. Free help I have already done. Charity before rice trainings I already have done, ma. 100
Yes, sir.
jobs I have shown for free. Okay.
Okay, sir.
Now whatever we are doing is paid. Okay. Even for this session also we are not charging 1 rupee. But to take it to next level, if you are really serious about your career, if you want to take training and placement support from us, if you can join our courses, we can do it. Okay. But not for free. Kindly understand that.
How much does it cost, sir?
We will tell you. We will tell you. Normally, our courses like this, we are supposed to send connect invite.
Okay,
What we are
sir.
supposed to do, connect invite. Then you can message them. Yes or no?
Yes, sir.
ఇలా వాడచ్చా వాడకూడదా LinkedIn? Especially, Amma.
Sir, I could not.
I'll tell you the courses packages here. Clinical research, it's nearly 15,000. Medical coding, 10,000. PV 20,000, 15K, medical coding 10K, medical writing 20K, but for you, we are giving a combination diploma for just 25K. You can take 3 courses. 3 courses for 25K. Earlier, we were against to these multiple courses. But based on students' needs, we started giving 3 courses. And everything is online. Everything is online. And you can ask me one more question. How should we check these institutes, whether they are good or not? How should you validate and verify? You can do 2 things. One is you can check their Google reviews. Yes or no, Soumya? Razu?
Yes, sir.
Check their Google reviews. For a biryani, we do Google reviews. For a movie, we do Google reviews. Yes or no?
Yes,
We
sir.
check Google reviews and go and watch the movies. And check the placement data. That is the only measurement, right, Soumya? I don't know how did you join Bharat University. Maybe by campus or someone would have referred you and someone would have told you that they have campus placements and which is the biggest university in Chennai. And your career will be settled. That's what your parents would have been told by your college management or your faculties. Yes or no?
Yes, sir.
But if you want to validate an institute, what you are supposed to do?
To check the Google review.
Second point is, who is running this institute? Whether he is from industry or not. Whether they can do placements or not. Check our placement data. From which year it is, Raju? We are from past 6 years in this industry. First year, we have started in 2018 and our student passed out in 2019. 17 jobs వచ్చాయి. తర్వాత 16 వచ్చాయి. And during Corona, more number of jobs our students got, nearly 38 jobs. 22 was a really great year for us. 58 jobs. Even last year, everyone was saying that market is dry, a lot of layoffs happened, a lot of people said like that. Even during that dry year also, we were able to get 22 jobs last year. This year also we have done around 15 jobs. We are supposed to update our website still. But trust me, for each and every institute, measurement is only placements. Okay. Thank you so much, guys.